Mic check, 1, 2, 1, 2. Okay. Good afternoon, everyone.
Good afternoon.
I want to thank all of you for joining us today. The elected officials who are standing with me, Council Member and Chair of the Health Committee, Dr. Nina Ahmad. We have also Council Member at Large, Ruth Landau. We also have Council Member Ketty Lozada from the 7th Councilmanic District, and also Council Member Jamie Gauthier from the 3rd Councilmanic District. And I want to thank them for taking time out of their very, very busy schedule on a Friday and standing with me, but also I want to thank the healthcare leaders and community advocates as we stand united to protect the health and well-being of Philadelphia's children, families, and our most vulnerable neighbors. I want to also acknowledge all of the attendants here today. So we have Christian Malloy, Corporate Director, Government and Community Relations from Penn Medicine, Patrick Vogelmore, Behavioral Health Executive, Temple Health Systems, Michael Allen, Chief Operating Officer of Wills Eye Hospital, Mr. Shelley Johnson, Director of Finance, Will Eye Hospital, Brian Keach, Senior Vice President, Government and Community Relations from Drexel University associated with St. Christopher's Hospital for Children, Karen Lewis, External Affairs, Drexel University associated with St. Christopher's Hospital for Children, Martin J. Sherman, Medical Doctor and Surgeon and Chief at St. Christopher's Hospital for Children, Paul Healy, Senior Manager, Communications and Public Relations for St. Christopher Hospital for Children. Y'all came out deep, St. Christopher. Will Carter, Vice President for Government and External Affairs for Jefferson Health. I want to thank all of them for being here. Can we give them all a real big round of applause, please, for taking time out of their schedule. We also will have speaking Dr. Cheryl Bedical, who we all know, who represents the University of Pennsylvania Perelman School of Medicine, and you'll hear from her and other individuals as we get started. We are here because the dangerous proposal making its way through Washington as we speak right now, which from my understanding is not a done deal, the so-called big bad bill. But let me be clear, I know it's big beautiful, but I don't want to acknowledge the big beautiful. It's a big bad bill. There's nothing beautiful about a bill that would take health care away from millions of Americans, including many Philadelphians. This bill threatens to strip health coverage from up to 1 to 5 children across our nation by slashing funding for Medicaid and the Children's Health Insurance Program known as CHIP. Here in Philadelphia, children rely on these programs to see a doctor, receive vaccines, and get the care they need to grow healthy and strong. This bill will impose harsh new barriers such as waiting periods, premium lockouts, and work requirements that will hurt families already struggling to make ends meet. It will put seniors, people with disabilities, and low-income families at risk of losing coverage when they need it most. The consequences does not end there. Over the next decades, these cuts will cost Pennsylvania hospitals $7.1 billion. Yes, that's billion with a B. Undermine the financial stability of the very hospitals we count on in our times of crisis. And I was just on the phone today with stakeholders from our state legislature, and they said they do not have the ability to provide the funding that will be needed in the event that these significant and drastic cuts go through. Imagine the burden and the impact of this legislation that will place on our hospitals, which are represented by these individuals are here today. Without adequate Medicaid funding, these hospitals will face skyrocketing, uncompensated care costs, staff shortages, and the potential loss of essential services. So we are gathered here today with a simple and urgent message. Congress must reject the one big beautiful bill. Our children's health, our seniors' security, and the strength of our entire healthcare system depend on it. To every Philadelphia listening, we need your voice. And I'm gonna say that again. To every Philadelphia listening, we need your voice. Call your members of the U.S. House and Senate, and although their goal is to get final passage of this bill by July 4th, it is not guaranteed. From my understanding, this is a very, very fluid process taking place right now, and so we should not rest until we get the job done. Share your story and demand that Medicaid and CHIP remain protected so that every child and every family in Philadelphia across this nation can access the care they need and deserve. Together we fight to protect the health, dignity, and future of our city. And some may say, well, you know, as local government officials, well, what's your role in this? I believe that we are on the front line, right? When we see these drastic cuts taking place in Washington, D.C., which is going to have a significant impact, particularly on neighborhoods that need it the most, we must do all we can do to raise our voice, demand and advocate to make sure that these cuts do not go through and minimize the severely devastating impacts that these cuts will have in the event that this legislation moves forward in Washington, D.C. You're going to hear from one of the gentlemen who I talked to about this particular press conference early on this week, and he talked about how significantly that if this bill goes past, the devastating impact it's going to have not only on the hospital that he represents, but all the hospitals across the city of Philadelphia and also within this region. That's Peter Groban from CHOP. Give him a round of applause because we're not only Felsian graduates from the same class at Penn, we also have continued to work to address the healthcare crisis and health equality here in the city of Philadelphia. But before I get to turn over the microphone to the representatives are here, our chair of health, Dr. Nina Mott, who's always leading the charge to address the health equity crisis here in the city of Philadelphia, making sure we're doing all the things that we can do to make sure that everyone in the city of Philadelphia, regardless of their zip code, their checkbook, and or their pocketbook, receive high quality health care. And that's Dr. Nina Ahmad.
Thank you, Council President Johnson, for your leadership and for bringing us together to stand up for health and dignity of our communities. The so-called one big beautiful bill is anything but beautiful. It's dangerous, it's reckless, and it's a direct attack on those who can least afford to lose coverage: our children, our seniors, people with disabilities, working families, and hospitals that serve them. This bill would gut Medicaid and CHIP, cutting $800 billion, I believe, in coverage. It would strip health insurance from 1 in 5 children nationwide. That is not irresponsible, it is immoral. Let me repeat it again. Not just irresponsible, it is immoral. In Pennsylvania, this means 300,000 people losing coverage. Families would skip essential care. Children would miss out on life-saving treatments. Pregnant people would go without prenatal visits. Our hospitals would absorb the $7.1 billion that was just mentioned in losses over the next decade, putting enormous pressure on systems already stretched thin. This could affect 477,000 healthcare jobs in Pennsylvania, with major direct and indirect impacts on state and local economies. We will definitely suffer in Philadelphia from that. More than half of Pennsylvania's acute care hospitals are operating at a loss already, and another 15% are close behind. Many of these hospitals rely heavily on Medicaid, sometimes up to 69% of their patient revenue. When you cut Medicaid, you don't just hurt low-income families, you put the entire health system at risk. In neighborhoods like Nicetown, Southwest, and Northeast, where we fought to expand access to primary and behavioral health care, this bill will undo years of progress in the matter of months. It would deepen health disparities and increase suffering in the very communities that need more support, not less. Let me be clear. Health care is not a privilege. It is a human right. Healthcare is not a privilege, it is a human right. And our country needs to start to acknowledge that. No one should go without treatment because of where they live, how much money they make. No hospital should be forced to close its doors because Congress wants to balance the budget on the backs of the vulnerable. We need to invest in care, not cut it. We need to protect the people who rely on Medicaid, not turn our backs on them. As the chair of the Public Health Committee and Human Services, let me say this with absolute clarity. I will not stay silent while Washington tries to gut the lifeline of our communities. which depend on this. I stand shoulder to shoulder with my colleagues, with everybody here and beyond, with our frontline healthcare workers, with the people of Philadelphia to say, hands off Medicaid, hands off CHIP, hands off our communities. Thank you.
Hands off. That's what I'm talking about. And you know, when we talk about balancing the budget in Washington, D.C., right? Let's be clear. This is more than about just balancing the budget. This is about individuals in Washington, D.C. who are focusing on providing a tax cut for billionaires, right? That's all it's about. They want to make sure that the gentleman from Washington, D.C., his rich friends, get tax cuts, and the only way that they're going to get these tax cuts are severely cutting Medicaid. Now, I'm going to veer away from my speaking points for a second because most people know in this body, I'm a strong advocate around the issue of youth gun violence, right? And it's these hospitals that are around us, that's standing behind me day in and day out, right? Work with individuals that come inside that emergency room that do not have health care, that do not have insurance, right? And they step up to the plate day in and day out, right? To still treat them patients, those patients, still make sure that they have the care that they need, but they incur the cost. And so we do thank you for stepping up to the plate when it comes to the issue, particularly around gun violence, and also just being a dad of two sons, one 10 and one 8. I have visited the emergency room on many given evenings, right? And so I do thank you for stepping up in that area as well. Now, the next speaker took it upon herself to also put together a letter to send to Senator McCormick, signed by members of City Council, particularly opposing these drastic cuts through this particular bill. And she got a significant amount of co-signers to sign on to the letter, but I'll let her tell you herself. I'm going to bring up Councilman Jamie Gauthier.
Good afternoon, everyone. I want to start by thanking Council President Johnson for convening us today and for your leadership. The first 6 months of the second Trump administration have been nothing but pain, cruelty, and hatred. Every day I wake up to a new headline that fills me with fear and disgust. But nothing Trump has done so far compares to his big, ugly bill, billionaire tax scam, which will enshrine draconian cuts to essential services that keep our communities safe and healthy. The big, ugly bill is over 1,000 pages, so long that many members of Congress have come out and admitted that they did not read it before voting to increase the national debt by $2.4 trillion with a T dollars in the process. In Philadelphia alone, 1 in 4 residents may lose their health care, but everyone will suffer. Our community behavioral health organization, funded by Medicaid, spent over $860 million on treatment in 2022 alone. Our city's crisis lines and urgent care centers are continuously stretched, responding to thousands of calls and encounters monthly. And cuts to Medicaid will endanger lives and push vulnerable individuals out of the system. As the chair of the Housing Committee, I would be remiss if I did not mention that Section 8 housing choice vouchers are also on the chopping block, putting nearly 20,000 additional Philadelphia families at risk of losing their homes. Affordable housing is health care. Affordable housing means families have enough money for essentials like health care and food. It lowers stress and improves mental health. And it makes it easier for folks to manage chronic health conditions and access preventative health care. It is clear that Republicans care more about handouts for their ultra-wealthy donors than they do about our communities. I want to thank Councilmember Ru Landau, Minority Whip Nicholas O'Rourke, Councilmember Dr. Nina Ahmad, Minority Leader Kendra Brooks, Councilmember Dr. Anthony Phillips, Councilmember Mark Squilla for signing onto a letter that I sent last week to Senators Fetterman and McCormick, warning them about the devastating impact of the big, ugly bill and the impact that it will have on the health of our city. And again, I want to thank our Council President for leading in so many areas to protect Philadelphians. I applaud Senator Fetterman for noting on the record that he will never support any bill that strips Medicaid, Medicare, or SNAP benefits from Philadelphians. And I want everybody listening at home to know that City Council will keep fighting for safe, healthy, and vibrant communities both here in City Hall and in Washington. Thank you so much.
Next, I'm going to ask for someone who we all know, Dr. Cheryl Bettercool from Penn Medicine, to please come on up. Welcome back.
Thank you, Council President, members of City Council. Just huge appreciation to you all for your advocacy. I know that there are going to be many people talking about the statistics and all the huge impacts of this big ugly bill. I really like that name for it, thank you. I'm going to be brief, but I want to talk about people. Because as we watch Congress debating this bill, which essentially takes away hundreds of millions of dollars in Medicaid funding to fund tax cuts for the rich, I've been remembering what it was like before the Affordable Care Act passed and allowed the Medicaid expansion. I practiced in the city health centers and what people were facing at that time, because I think a lot of us have forgotten and we cannot afford to forget. So, when we think about Medicaid and what happened then, a big piece of what happened with this, what we call the expansion population, which is one of those phrases that doesn't have any people in it, so it doesn't feel meaningful. It was working age adults who were not disabled, right? And that's who got coverage then, and that's probably who stands to lose coverage now, because even though we're being told that no one's going to lose their Medicaid, and these working requirements and so on, probably what happens if you pull hundreds of millions of dollars out, the states have to do something. And they're going to want to make sure babies are covered and pregnant people are covered, and that probably leaves our working age adults. So just thinking about what that looked like, we're talking about young adults who couldn't qualify for coverage, no matter what they did. And so they skipped medications, right? They might have maybe a little high blood pressure. That blood pressure medicine could wait until they got the job with benefits, even if that was years. And I just want to point out that when their kidneys failed, they were then eligible for Medicare. And what a thing to do, and what a colossal waste, not only of money, of course, but of humans, because dialysis is so taxing on people and so life-changing. People who had fractures that did not get treated for months. I remember taking care of a young woman whose ankle fused sideways and had to be rebroken and reset, and she still would never walk completely normally. 26 years old, that's what that looked like. People in their 40s and 50s who'd worked for decades, who retired early because of medical problems on a pension and then couldn't get coverage, couldn't afford COBRA, couldn't get coverage anyway, anyhow. So again, skipped those medicines that kept them out of the hospital, ended up in the hospital, ended up with strokes and heart attacks. That's what things looked like. And then children and toddlers. And I know that we're all being told that they won't lose coverage, right? They're a priority population. But when we add regulations, when we add paperwork, when we add bureaucracy, when we make people renew again and again, and we're looking for reasons to kick people off, we lose kids. And what that looks like for kids isn't just shots delayed, which matters a lot, but it's also developmental screens that don't happen. I saw a 4-year-old who had never been to the doctor and did not speak. And we missed that entire period of time for early intervention to help him grow up normally. That's devastating. When kids get sick and care gets delayed, children suffer, they suffer from fractures, they suffer from pneumonias, they suffer from things we can treat and should treat. And our job as the adults in society is to protect those kids and make sure they do not suffer. and we will fail at doing that if this bill passes. So, I feel really proud to live in a city that has a commitment to take care of its people, but there are limits to what we can do, and Medicaid helps us to do that. And so, what we're facing now is something that we can't allow to happen, that is devastating and that will cost us in human potential and in morality, in ways that we will have a very, very difficult time recovering from, and that will cost lives that will never come back. So thank you all for being here. I appreciate your advocacy.
Thank you. I think something else that Dr. Sherrill talked about is that we talk about policy, but most importantly, we're talking about people who are going to be significantly impacted. And most likely, it's not going to be us standing up here, right? It's going to be those who are most vulnerable that don't have health care, that don't have health insurance, and that's why it's critically important that we continue to fight back. And so at this particular time, I'm going to ask for Claire Almine from St. Christopher's Hospital for Children to please come on up, Chief Nursing Officer.
St. Christopher's Hospital for Children is truly a safety net for children and their families. 85% of our patients, 85% of our patients are insured by Medicaid. That's the highest in the country, right here in North Philadelphia at St. Christopher's. At St. Chris, we see 55,000 children a year in our emergency department. In the past 4 years alone, we've treated nearly 200 children who are victims of gun violence. We are one of only four level 1 trauma centers in the state of Pennsylvania. We are one of the largest graduate medical education programs in the country. So preparing and training future pediatricians for all hospitals. St. Christopher's is a beacon of hope in our community, in the city and surrounding areas. If, worst case scenario, St. Christopher's had to close because of Medicaid funding cuts, the surrounding hospitals in Philadelphia and southeastern Pennsylvania would not physically or financially be able to handle the patients that St. Chris currently cares for. It is vitally important that we protect Medicaid funding so that St. Christopher's and hospitals just like ours can continue to provide that care that these patients and families deserve. Thank you.
Councilman Jamie Gauthier said it's a big, ugly bill. Very well said. Our next speaker is Peter Groman, Senior Vice President, External Affairs for Children's Hospital of Philadelphia, better known as CHOP.
Thank you very much, and thank you very much, Council President Johnson and members of Council. I'd be remiss not to thank everybody here who provides medical care each and every day to Philadelphia citizens, so let's give them a round of applause. I was so happy to get the call from the Council President the other day because, as he typically does, he calls and he says, "How can we help?" He's aware of the crisis that's in front of us. And I said, advocacy, advocacy, advocacy. I'm so grateful that everybody came together today because this is particularly important, especially for children, as we just heard. Half of the nation's children are covered by the Medicaid program. Half of the nation's children. 600,000 Pennsylvania children are covered by the SNAP program. So there's a lot at stake here right now. But I just want to take a moment to tell a quick story because the privilege that I had a few weeks ago of going to Washington with a family, with a young child, and this young child was actually born twice. So he is a fetal medicine patient at CHOP who was born with spina bifida. And from a novel technique developed at CHOP, he had fetal surgery for spina bifida. He went back into the womb and then was born. And here I was in Washington, and he's going from office to office, climbing up and down on chairs, walking through the halls, and meeting with members of Congress, with his family. And it was the most amazing thing that I've seen in my life. It's a reminder that Medicaid touches so many lives, from primary care to the most specialized care imaginable here in the United States. And so I say this because I am feeling optimistic that with advocacy, we can bring people together to do right by our nation's children. So thank you very much.
And even as we talk about children, I was talking to some individuals who were doing some advocacy down in DC, and they talked about how the state of Pennsylvania has a very large aging population, right? In a lot of parts of rural Pennsylvania, individuals who rely on Medicaid are seniors living in adult population assisted facilities all across the state of Pennsylvania, who will also be significantly impacted. And Peter, he talked about trying to maneuver and create a fund just to protect those hospital institutions, those aging nursing facilities across the state of Pennsylvania to only support those who are in rural Pennsylvania. And so part of the politics around this is that in some of those Republican areas, these cuts are going to have a significant impact. They vote against their own constituents, and that's why it's important for us to continue advocating until the end, because I do know for a fact, we're talking to different leaders, that this process is still a work in progress. It's not a done deal yet, and that's why we're here today. And so I'm going to ask for Julia Platt from Mental Health Partnerships to please come on up. She's the Director of Advocacy and External Partnerships, External Affairs.
Thanks so much. Hi, everybody. Thank you so much for having me. And I am proud to speak on behalf of Mental Health Partnerships, which is a nonprofit based right here in Philadelphia that spent the last 4 decades working on the front lines of recovery. I think the recovery community is often left out in this conversation as well. So at MHP, we provide mental health and substance use services, including care coordination, housing, and support from certified peer specialists. These are individuals who have lived through their own recovery and now walk alongside others through theirs. Every day we help people stabilize, reconnect with their communities, and rebuild their lives. But all of that depends on one thing, which is Medicaid. And today, along with everyone here, we're raising the alarm about the reconciliation bill in Congress, which would gut Medicaid, impose harmful work requirements, and rip the lifeline away from millions, including the 1 in 4 Philadelphians who rely on it. I just want to talk a little bit about the bill's work requirements, which are especially dangerous. These policies won't help people get jobs. They'll just cause them to lose coverage. We know this because we've seen this before, and we also know the facts, and the facts are on our side. 92% of adults on Medicaid are already working, in school, or living with disabilities, or caring for a loved one. The few who aren't working face real barriers like stigma, unstable housing, or mental illnesses that are not yet treated. I just want to give a quick real-world example of how these work requirements would actually end up working. So think of someone named Maria. She lives in North Philly. She has bipolar disorder, and because of Medicaid, she sees a therapist, takes her medication, and meets weekly with a peer specialist who helped her stay in recovery. But if this bill passes, Maria must prove that she works 80 hours a month, and if she misses one deadline, form or document doesn't upload, she loses everything: no meds, no support, no safety net. We've seen what happens next: crisis, hospitalization, even homelessness. And as the Congressional Budget Office, which is nonpartisan, already concluded, work requirements do not increase employment. Implementing these would account for the largest share of federal Medicaid savings and would cause the largest increase in the number of people without health insurance. I just want to say that here's also what's really important. The American people do not want this bill. 72% of voters across the political spectrum view Medicaid favorably. 84% of voters, including most Democrats, Republicans, and independents, say that Congress should protect Medicaid, not cut it. And lastly, the majority oppose cuts or work requirements, especially if they're used to fund tax breaks for corporations or the wealthy. So I just want to be clear, this is not just bad policy, it is deeply unpopular. Members of Congress supporting this bill are ignoring their constituents and putting ideology ahead of lives. At Mental Health Partnerships, we know what happens when Medicaid is available. People heal, families stay together, and ERs aren't overwhelmed, and communities thrive. So today, along with everyone else here, we call on Congress to reject this reconciliation bill, which is what the people want and what we all deserve. So, thank you.
So before I open it up for questions, brief questions from the media, and Peter, as I was going through this process and talking to the chairman of appropriations in Harrisburg today, that's State Representative Jordan Harris, also talked about how prior to Obamacare, he was explaining how people would go to the emergency room for all their basic primary care types of issues. And until we had the expansion, right, that included more individuals to be covered by Medicaid, we begin to turn the tide. And if we don't have the Medicaid support that we need, again, all of that pressure is primarily on our healthcare systems, which at the end of the day, long term, will not be able to sustain us. So this is why, again, I'm just calling for everyone inside this room, and particularly all of our healthcare advocates who are up here, make sure that as we go throughout this process, and even the day, the weekend, until this final vote, make sure you're reaching out to Senator McCormick's office, Senator Fetterman's office, and making sure you're letting your voices be heard. I'm gonna say that again, make sure you're reaching out to Senator McCormick, as well as Senator Fetterman, and also still call your congressional reps. I've been in contact with each and every last one of them saying, this is our position. We need to make sure we save Medicaid and protect people. And so with that being said, I'm going to open it up for questions from the press. Well, first and foremost, we won't be able to sustain the significant cuts that's going to take place if this bill moves forward. If the state can't do it, which we receive funding from, surely we can't. But nevertheless, within the small budget and the grand scheme of things that we do have, we will pay attention to the services that we're providing to those who are most vulnerable. And as we always have done and continue to do everything we can do possibly to help as many individuals as possible.
An idea of how much, in terms of lost revenue and job losses, these cuts would actually occur in the city and with the
I don't have that direct number. 1 second. Well, the chair of health. Go ahead.
These are not hard and fast, but the impact would be, it would affect 477,000 healthcare jobs. So the indirect and direct impact is to be determined, but this is the number that will cause those impacts to happen. As of yet, yes.
They have them. They're on the Department of Human Services website.
Human Services website.
The Department of Human Services of Pennsylvania has a data website, and it goes by different counties. Oh,
Yeah.
giving back. I don't actually. If you go onto the Department of Human Services website for the state, they have the county list of all across Pennsylvania, and it goes through and shows what the economic impact of Medicaid expansion has been, as well as how many jobs will be lost. We also have that by congressional district, as well as tons of other information that I can provide. So.
And just to underscore, it's not just the direct and indirect in the economic sense, but we have to think about what having loss of vaccinations will do in terms of endemic issues. Those are all going to be piling up one on top of the other to have a much more serious effect than what we have numbers to show just now.
And, you know, I know it's the economic impact, right? But for me, that's just so shrewd. I'm talking about the loss of life, right? I'm talking about the children who won't have quality health care and the significant impact it'll have on their lives. And that's the context in which I think, because this bill for me is immoral, right? And it's a matter of social justice as to why we are here today. Last question? Okay. Well, listen, I want to thank all of our healthcare institutions for taking time out of your schedule. I think we talked, Peter, what is this, Monday, maybe Tuesday, for being here. And I want to thank first and foremost, my colleagues for being here on a Friday and taking time out of their schedule and standing for what's right when it comes to addressing this health inequality within this big, ugly bill. And so with that being said, thank you all for being here. We're going to take a quick group shot.
You see the city of Philadelphia hosting, we use an intergovernmental collaborative process. So this is standard operating procedure for us. Thank you all so very much for being here.
I refuse to do this alone, so I got my colleagues right here beside me. Good afternoon, everyone. Thank you all for joining us today on this joyous occasion. My name is Dion Sumter, and I am the Deputy Director for Violence Prevention Initiatives for the Office of Safe Neighborhoods within the Office of Public Safety for the City of Philadelphia. Before we begin, I would love to just do a round of introductions to our Office of Safe Neighborhoods, our fellow directors and deputies. Dr. Palmer.
I'm Dr. Mary Palmer, and I'm Director of Faith-Based Affairs for the Office of Safe Neighborhoods.
Good afternoon, everyone. I'm Eric Westbrook, Deputy Director for Community Partnerships with the Office of Safe Neighborhoods.
Good afternoon, everyone. My name is Pamela Chase, and I'm the Director of GBI.
Good afternoon. My name is Keith Scott. I'm the Director of the Community Crisis Intervention Program.
All righty. Good afternoon, everyone. My name is Chelsea Gillette, Deputy Director of Operations for the Office of Safe Neighborhoods. Happy Gun Violence Awareness Month.
Good afternoon, everyone. My name is Michelle Dowell, and I am the Director of Tactical and Community Response.
Thank you all. And oftentimes, even for me to be up here, I wish to be joined by my fellow colleagues, and that's on the message and the work that I've learned from my fellow mentor, Executive Director Shondell Revelle. There's women and men who often are doing the amazing work behind the scenes that may not get the credit. So the work that's being done within our office is a credit of our leadership, our deputies, and our directors. But today, we're really here to really honor our fellow women and men who are a part of this amazing joint warrant task force that are constantly out there on a day-to-day basis, risking their lives to identify high-risk offenders who are under warrant status, to not just pick them up, but to do it in a very humanistic, holistic fashion. Before we go into the great work of our fellow women and men who are part of this amazing task force, I just asked, we also have some out-of-town guests who are here to be a part of this occasion. Our fellow friends from Louisville, Kentucky, could you guys stand up? As you know, within the city of Philadelphia, within almost a 3-year span, we lost close to 1,500 lives in the city of Philadelphia. And last year, we saw some historic lows. Those lows are just a product of the collaborative efforts that are taking place within the city of Philadelphia, from the DA's office, adult probation, juvenile probation, our federal partners, community-based partners within PAN, Eddie House, and IDAY, all across the board. And Louisville is here to learn from our fellow projects and strategies to find ways to be able to have similar success and results in their city. So Louisville, thank you all for traveling so far to be here. Still go Eagles. And in reference to this joint warrant initiative, this was a project that was under a lot of consideration within our office. And our Executive Director, Shondell Revelle, saw a vision of being able to merge worlds of law enforcement partners. Instead of serving warrants alone, why not do it together? While we identify and engage these individuals, not only will we remove them from the home, but let's also find social service resources to ensure that we're able to support them once that fellow breadwinner is removed from that home. I would love to talk further about this task force, but I'm going to allow the man whose vision and imprint has allowed us to be here today. So without further ado, I'd like to introduce our Executive Director, Shondell Revelle.
My notes. Good afternoon. And as Dion said, this office, was formed with a community lens. All the work that we do and that we continue to do has a community lens. But we would have to be deaf to the issues that go on in our community if we don't recognize law enforcement. They've always been a partner since Councilman Jones gave us our first funding and put us on this task. And the vision for what the Joint Warrant Task Force came out of just made sense to me. Now, let me just take you back. We're talking 2019, 2020. COVID is escalating, and the communities are challenged. We needed a way to not only address the fact that when individuals are on warrant status, they are more at risk to be involved in an incident or creating an incident. So my vision was to create a mechanism where we can have individuals that are high risk with partners from local, state, federal law enforcement to go into our communities that are most high at risk for facilitating violence. Not only take these individuals out of their situation, meaning their home, but looking at and analyzing the effect of that and then coming up on a system. We know that when individuals are taken out their environment, most of the time they're the breadwinner. Let's just be all honest about it. So how do we make sure that family that we're taking them out of, or that community is serviced? So the vision was to have a social service component to it, to go in and make sure there's an assessment of that family, make sure those families are taken care of from the day one, whether it's providing food, whether it's, in some cases, looking at their situation as far as rent, or maybe relocating them, or maybe buying a refrigerator, or just sitting down and having a simple conversation about what's the process moving forward. So what makes us unique, and I won't belabor it, is we not only take individuals out, but we care about the families and the communities as well. And we continue to do that. So in saying that, I have to give thanks to certain individuals and agencies that made it happen. And I think that's why we're here now. But overall, juvenile probation, Chief Castro Jimenez has been a leader in this. Paul Visa, Deputy Chief Benny Price, incredible support. U.S. Marshals did train us in 2020, but local law enforcement, Sheriff's Department, PPD, they took on the mantle every week, going to the communities that most of them are from. And they continue to not only make it safer, which is one of the main staples of this, but also keep the community whole as possible and fix what is broken. So without further ado, what I want to do is I want to bring up someone who's special to me. And again, as I said, help this office, formerly the Office of Violence Prevention, gave us our first funding and put us on task to where we are today. Councilman Curtis Jones.
Sometimes, when you've been in office long enough, you have to look at progress in time-lapse photography. I take you back to a time before this administration, before your office, when we had no cohesive strategy to deal with gun violence, that we knew where we were on the environment, we knew the plan for the city of Philadelphia for economic development, but gun violence prevention wasn't on the top 10 things that we cared about. I used to say that if 300 whales washed up on the shores of the Schuylkill, every marine biologist, even Jacques Cousteau from his grave, would come out and figure out why. But 500 people wound up shot and killed. We didn't have a plan. So take note that I'm thankful for now, today, time-lapse photography. Look at the collaboration just in this room. And when we start looking at the results of the reduction of gun violence, it is because of those collaborations. The second thing that I will say, and I did this under your watch, the right hand of fellowship or the left hand of punishment was very true. We went out on a visit to a high-risk individual, came to his door, and we had the DA, we had the